So for those of you who may not know, New York Presbyterian Lawrence Hospital is based in Bronxville, which isn't that far down the road from Harrison, off the Hutch and Cross County Parkways. We opened our doors in 1909, so we've been around over a century. We joined the New York Presbyterian Regional Hospital Network in 2014 and became an official campus of New York Presbyterian in 2018. Why is that important? Well, it's important because that means we've had an addition of a number of surgeons and physicians, as well as access to specialties we didn't have before. We have access now to clinical trials for our patients. So this affiliation and now being a part of the New York Presbyterian family means extra resources that we didn't have before that now our patients can benefit from. We have over 1,700 employees and more than 30,000 visits to our emergency department. At New York Presbyterian Lawrence Hospital, we are a Commission on Cancer designated cancer center. We also have a New York Presbyterian cardiac catheterization laboratory. And why is that important? Heart disease is the #1 killer in Westchester County. And as a result, we often see a number of patients coming in with chest pain, or those people who need a pacemaker, who may need stents. We've saved countless lives with this cath lab since it opened up a few years ago. We're also a New York State Department of Health designated stroke center, and we have a sleep center for those people who have issues with sleeping. We know that COVID is top of mind for a lot of people right now. And we just want to remind you that our hospital and medical group physicians' offices are safe and ready to treat you. We've instituted a number of safety protocols at our respective locations. We've staggered appointment visits so that we don't have a number of people waiting together in the waiting rooms. So there's a lot of work that's being done. Insisting that everyone come in with a mask. We take temperatures. There are a number of new protocols in place to make sure that everyone is safe, patients, staff, and visitors alike. New York Presbyterian Lawrence is very committed to serving the community on a variety of levels. We have physician lectures, screening events. We offer support groups to members of the community. We have health classes. We also have something called charity care. So we don't ever want anyone to avoid going into the hospital for care. We encourage them to do so. There is financial aid available. There's information on our website, nyp.org/Lawrence, that comes in multiple languages. So if you are interested in learning more about financial aid for your health services, that information's on our website. This afternoon's speaker is Grace Kulinski. Grace is a physical therapist and manager of rehabilitation medicine at New York Presbyterian Lawrence Hospital. Grace has been a physical therapist for more than 40 years and is based at our off-site physical therapy location in Eastchester. Grace spent her early career at St. Agnes Hospital before coming to NYP Lawrence. For the past 2 decades, Grace has been caring for patients at Lawrence, which includes taking her skill and expertise on the road to local senior centers where pre-COVID, Grace led in-person senior exercise classes. She also participates annually at the Salute to Seniors program held at the County Center in White Plains. Grace is a graduate of Ithaca College. So please welcome with me, Grace Kulinski.
Thank you, Elisa. Welcome, everyone. Good afternoon. I'm glad you're joining. You can give us the next slide, Elisa. So you're here to learn about preventing falls inside and outside. So again, next slide. So just a little introduction that every year thousands of senior Americans die or suffer serious decline in the quality of their lives as a result of falls. Each year, half the senior population does experience falls, and 20% of those people who experience a fall again within 6 months. And due to the rising costs, health costs, in an effort to decrease suffering as a result of falls prevention has become a focus of the medical community. Sometimes falls cause little or no injury, but even though that happens, that there's no injury, some people develop a fear of falling and then develop fall-prone behavior. Next slide. A fracture, which is a common consequence of a fall, often results in functional decline. In fact, fall-related hip fractures are the leading cause of disability in seniors. And as a result, we should know that older women are 3 to 4 times more likely than older men to fracture their hip because of osteoporosis. So the more seniors know about fall prevention, the more they can actively participate in making their surroundings safer and forestalling problems. Next slide. So there are a couple of quick tests that people can do at home with the help of a family member or friend who has a stopwatch. The first test is called the timed up and go test, or a tug test. You start out seated in a chair. A distance of 9 feet, 10 inches is measured out. So you sit in a chair, the person who's timing you says go. You would get up from the chair, walk the distance of 9 feet, 10 inches, turn, walk back to your chair, and have a seat. And once you're seated safely, the timer stops. If you use an assistive device like a cane or a walker, you are allowed to do that during the test. Next slide, please. Thanks. So if this activity takes you more than 30 seconds, you're considered at a high risk of falling. If it takes you 10 to 30 seconds, you're at a moderate risk, and less than 10 seconds, you're at a low risk of falling. Next, please. So the next quick test is called the single leg stance. Again, you need a partner to help you with the stopwatch. You have a sturdy chair. You hold on to that chair. You raise one leg up off the floor. Once you feel steady, you release your hands from the chair and they begin to time you. Next slide. So if you can stand less than 5 seconds, you're at a high risk for falling. If it's 5 to 15 seconds, you're at a moderate risk. Greater than 15 seconds, you're at a low risk of falling. And it's a good idea, if the next time you go to the doctor, to just tell the doctor the results of these 2 quick tests, because then the doctor can advise you on something that you can do, whether you need an assistive device to walk, or physical therapy would help you, or strengthening exercises program will help you. Next, thanks. So around your home, let's talk about the lighting. Proper lighting is important in your home because you want to see any obstacles that could be in your path. Next. So you ask yourself some simple questions. Are your indoor lights and night lights bright enough to compensate for any changes in vision? Are the lights glare free? Are your light and lamp switches easily accessible? If you answer no to any of these, you should check to make sure that the light is bright throughout the house, especially in stairwells. And it's a good idea to have night lights between your bedroom and your bathroom to light your way for you to walk to the bathroom in the middle of the night. Next, please. Next slide. So a lot of clutter, loose carpeting, and a lot of furniture in your home can also increase your risk of falling. Again, next slide. So you would ask yourself some questions. Are rooms and hallways free of clutter to permit safe walking? Are carpet edges smooth and straight? Are door thresholds actually wide enough to permit safe mobility? Do you feel comfortable reaching overhead in closets or cabinets without losing your balance? And also, are you comfortable reaching down to pick an object up from the floor without losing your balance? Next. Some safe remedies for this. You would remove any throw rugs and replace with non-skid rugs. You would avoid floor clutter, low-lying objects, and thick pile carpets to minimize tripping. Secure your loose lamp and telephone cords that are in the walkways. Remove furniture that's too low and difficult for you to get up from. You should arrange your furniture in a way that you have wide walkways. Move the objects to positions in cabinets or tables where they are more easily accessible. Wipe up floor spills immediately so that you don't slip. Something else that people will do is they will purchase a reacher in order to grab something from the floor or to reach something high up in a shelf. It's an alternative. So many falls happen in your bathroom. There are certain things that you may want to modify in your bathroom. Having non-skid strips or mats in the tub, installing, having grab bars for security, elevate toilet seats so they're high enough for you to get up from, and have bath mats that are non-skid and secure. Next slide. So I just basically told you the best thing to do, that to have a tub bench or a seat for stability when you're taking a shower, to have those grab bars, but professionally installed around your toilet seat or in the shower stall. Have a raised toilet seat to make it easier to get up, and make sure the bath mats are secure, especially when you're stepping out of a shower. Your next slide. Okay, if you use canes, walkers, and crutches, if they're in poor condition, you will want to repair them so that you don't have an increased risk of falling. So you'd ask yourself the following questions. Are the rubber tips on the base of your equipment worn down? Are the nails or screws broken or missing from the equipment? Is your assistive device the right height for you to use? Are you using your assistive device properly? And some remedies for the safety is to purchase new rubber tips for the crutches or for the canes, and replace any broken or missing screws. Shoes are also important. The types of shoes you wear can affect your safety in standing and walking. Proper shoes can give you the support you need to maintain good balance. Comfortable shoes can also help you stand and walk better. And just a word to the wise, you shouldn't wear just your stocking feet when you're walking on wood floors, because that's very slippery. Okay, next slide, please. Ask yourself some basic questions about your shoes to understand how shoes can affect your balance. Are the soles of your shoes slippery? Do they stick to the floor? Do your shoes lack heel support, like slippers or backless shoes? Did you recently change the type of shoes that you're used to wearing? Do you wear high heels? And if so, do you wear them all the time or just on special occasions? Do your shoes cause foot pain or blisters? Do your shoes fit well? Are they tight or loose when you're standing and walking? Are your shoes worn out? And do your shoes have thick soles? And your next slide, please. And if you answer yes to any of the questions, consider the following. Wearing sturdy shoes with non-slip soles. Wear shoes that fit well and are supportive and that don't cause pain. Wear shoes with a wide and deep toe box to give your toes freedom to move and to react to changes in the floor surface. It's a good thing to buy shoes at the end of the day when your feet tend to swell up because of the increased circulation, so you'll have a better fit to the shoe. Maintain your shoes with regular replacement of worn soles and heels. Avoid, as I said, the slippers or the backless shoes because of instability when you're walking. The running shoes with very thick soles can also cause you to lose balance. Avoid high heels or shoes with the narrow heel because that narrows the base of support. A heel will narrow your base of support. It can also decrease your walking speed and cause you to trip. Then next slide. Some health problems can affect your balance, causing you to be at increased fall risk. Do you have loss of feeling in your feet, dizziness when you stand up, get out of the bed, or abruptly change position, palpitations or a sensation of a racing heart, swelling in your legs, joint stiffness with limited flexibility, pain at rest or during movement, which might limit the movement of your joints or muscles, which decreases your reaction time, so your ability to correct yourself if you lose your balance. Unexpected and recent dramatic weight loss, confusion, difficulty paying attention or remembering things. Next slide. Sometimes an interruption of your regular activity, such as prolonged bed rest or a hospitalization, can cause general weakness, especially in your legs. If you, have you had a recent hospitalization? And if you answer yes to any of the questions, it's seek your doctor's advice in terms of an activity program to help minimize your risk of falling. The medications you take and the side effects of those medications can affect your balance. So ask yourself the following questions. Do you feel drowsy or dizzy? Do you feel confused, forgetful, or disoriented? Are you having trouble sleeping? And if so, are you taking medication to help you sleep? Are you taking more than one medication? Are you taking the correct dosage and on the prescribed schedule? If it's a morning medication, you take it in the morning. If it's an evening medication, you take it in the evening. Do you take medication to lower your blood pressure? Next slide. If you answer yes to any of the questions, discuss the issues with your doctor, ask about the side effects of your medicine, review the dosage of your medication, review all of the medications and ask if any of your symptoms may be due to the combination of drugs that you're taking. Anytime you add a new drug, it's a good idea to find out how that drug is going to react to the other medications that you're taking. And you want to check for the expiration of your medications. If you buy over-the-counter drugs or herbs without a prescription, you want to read the label and you want to ask your pharmacist if there's any contraindication to taking that drug with your prescribed medications. So you need to be very careful with meds. Alcohol can affect the way you walk and your balance. For some, alcohol can interrupt balance and judgment and put a person at a higher risk of falling. Alcohol together with your medication can affect your balance. Next, blurred vision or difficulty seeing in dimly lit rooms can reduce your safety and increase your risk of falling. Ask the following questions about your vision. Do you have blurred vision? Do you have difficulty seeing at night? Are you unable to focus on objects too close or too far from you? When you read, do you get headaches? Have you been diagnosed with any specific problems like glaucoma, cataracts, macular degeneration, diabetic retinopathy? And do you wear glasses? Next slide. If you answer yes to any of these questions, consider the following. Have your eyes checked by a doctor on a regular basis. Make sure if you wear glasses that you're going to clean those lenses on a regular basis. If you have more difficulty seeing in dimly lit rooms, you want to increase the lighting in those areas. You can ask your doctor about low vision therapy. Be aware of that your vision may be blurred for a short time after visiting a doctor, especially if they put eye drops in your eyes. Next slide. Okay, there's something called a hip saver. In addition to having strong muscles around the hip, wearing a protective underwear that is padded helps to reduce the risk of hip fractures. But I have to be honest with you, I've never seen anyone wear something called a hip saver. It was in the literature, so I decided just to include it. But I can tell you, I've never seen it worn. Next slide, please. So let's talk a little bit about outside. You want to be aware of your surroundings. You want to watch for uneven sidewalks and ground, fallen branches and other obstacles that could be in the way when you're walking. When the sidewalks are slippery, it's a good idea maybe to walk on the grass. You want to wear low-heeled and rubber-soled shoes for traction. If you are unsteady, it's a good idea to have an assistive device along with you, a cane or a walker outside. Carry rock salt or kitty litter in your car in the winter to sprinkle on slippery sidewalks. At night, you want to park in well-lighted areas. If possible, it's a good idea to have a flashlight with fresh batteries in your car. But also realize nowadays all our cell phones have flashlights, so that's a good thing. It's good to take a flashlight or wear a headlamp if you're walking before dawn or in the evening. Use handrails to go up and down steps or on escalators whenever you're inside or outside. Next slide. It's a good idea that before you leave for the evening to turn on your outdoor light, so you know when you come home, you're going to have a well-lit area to walk in. Keep your hands free by using either a shoulder bag, a backpack, or a fanny pack. And it's a good idea to use delivery services for medication and groceries, especially with inclement weather. Check the height of the curbs and the stairs before stepping up or down. Take note of those curb cutouts for wheelchairs and bikes, because if you are not aware that it's there, you can just misstep and be surprised and end up on the ground. Okay, so next, physical activity is important. It helps to maintain a healthy balance system. So physical activity increases your strength, your flexibility, your coordination, which thereby decreases balance and decreases your fall risk. It also, physical activity helps with correct posture, better body awareness, and increased confidence. Regular physical activity is recommended by the American Heart Association and has been shown to reduce incidence and severity of many medical conditions. So exercise is great for anyone with heart disease, arthritis, obesity, high blood pressure, diabetes, and osteoporosis, because that exercise will help to strengthen those bones and prevent fractures. Next, types of physical activity. A great one is walking. It helps to maintain strong bones. People with arthritis and have painful joints, water exercises are great because the buoyancy of that water helps to relieve the pressure on those painful joints. Strengthening exercises can be done easily at home. They don't really require much equipment, and it helps to increase and maintain muscle strength. When you start an exercise program, really you should be checked out by your doctor before you do start one. But any medical condition, whether it's cardiac, shortness of breath, back pain, diabetes, high blood pressure, it all will benefit if you do an exercise program again, but you want to first be checked out by your doctor before you start a new exercise program. Okay, next slide. So to conclude, seniors are realizing that they can do something to minimize their risk of falling by making safety awareness and fitness a regular part of their lives. It helps to improve your mental outlook, your emotional outlook, your social well-being. Increasing fitness can lead to restored confidence and greater participation in activities in your home, at work, and in the community. And hopefully once COVID gets better, we will be out there in that community again. These are my references for my information. Next slide. Here's our information, myself and Elisa, and we are open to questions. Happy to take any. Hopefully I didn't go through too quickly.
That's okay, Grace. Thank you so much. That was a wonderful presentation, and we want to encourage everyone to type in your questions in the chat. Feel free to quiz Grace. She's got lots of experience and working with folks. I do see something in the chat. Okay. Simple exercises, Grace,
yes,
to improve balance. Any thoughts on that?
Sure. Well, a combination of stretching exercises and exercises standing at your kitchen counter, holding onto a chair, working those hip muscles, bending that knee, doing a marching activity, up and down on your toes. Those type of exercises help with balance. Stretching, it's like stretching your heel cord out, doing some pelvic tilts. I don't know if people are aware of pelvic tilts, some hamstring stretches. These are all basic exercises that people start with to just get into an exercise program. They're low level and they're safe to do as long as you're holding on to something when you are exercising.
There's a question that asks, what's the reason for falling immediately? It says on getting up from lying down. I'm not quite sure.
Well, before, you don't want to just jump right up from a fall. You want to take inventory of yourself. Did you hit your head? Do you feel pain? Did you twist your ankles? So you kind of want to like feel the different parts of your body to see how they're feeling, before you try and get up. Always good. A lot of times it's great if you have one of those monitors that you can just hit that button to get some help, or you call for somebody. And hopefully you can get yourself up. And the best way to get yourself up from a fall is to get yourself close to a chair or some type of piece of furniture that is sturdy, so you can rest your arms on that and get yourself up one leg at a time to a standing position. But obviously, if you can't do that, if you're seriously hurt, I hope no one would fall and break a hip, but that's definitely possible. You definitely need some help. You need somebody to get to you and help you.
Grace, here's a question. Again, COVID's top of mind for a lot of people. This person is saying, given the pandemic, and I know this might be a little out of your wheelhouse because you're a physical therapist, but this person's asking, how safe is swimming at gyms, again, during the pandemic? And I know that's, again, maybe out of your wheelhouse.
Yeah, you know what? I personally would not be in a gym or go swimming unless they really socially distance, they limit the number of people that are there. Obviously, you can't wear a mask when you're swimming. When you go to a gym, you can wear a mask. It's to your comfort level. It really is to your comfort level. And you want to watch, you could ask them before you even join a gym or start exercising, tell me what is your protocol here? How do you clean your equipment? How often do you clean your equipment? Because the CDC says mask wearing, social distancing, wash your hands. Do they have the necessary Purell or wipes that you need to wash your hands? So basically, attending these places, it's all your personal choice and how comfortable you feel there.
Thank you, Grace.
You're welcome.
Is weight-bearing exercise important for arm and leg strengthening? And can you give us some examples of some of those?
Weight-bearing exercises are important for osteoporosis, and yes, to strengthen those bones. You can do, weight-bearing, the best is walking. And I will always say that the best is walking. Exercising, as I had said, with standing and doing the kicks out to the side and bending the knees. In our department, we use something called TheraBand, and that gives you some resistance, and that resistance helps to strengthen those muscles. For your arms, people sometimes use cans of vegetables. Some people do have weights at home. They can use a 2-pound weight, 1-pound weight, whatever they feel comfortable using, and you work your biceps and you work your triceps and you raise your arms up. Those are simple exercises.
And we've got a question, and I think this is similar to what someone asked earlier, but can you provide suggestions for how you might catch yourself if you are falling? So you've heard of people who brace their fall with their hands and then they end up breaking
their wrist. Right. I know, it's so, what can I say? It's, sometimes when you're in that moment and you start to fall, it's like just human nature that you're going to put those hands out, which is not a good thing to do because of it. I wish I had an answer for you. How do you make yourself fall the right way? I guess falling on your bottom is better than falling forward and using your arms. If somebody's with you, it would be great if they can, if they're there to help you. A lot of times putting a foot out, sometimes, you trip and you try and put that foot widen that base of support and catch yourself with your foot. there's no real answer for me to give you in terms of stopping a fall.
Grace, are you acquainted with Tai Chi? And would you please say a few things about it? Is it a good way to improve balance?
I have not taken Tai Chi personally, but Tai Chi is a good way to improve your balance. I did see something quick. Someone mentioned about yoga. Yoga is also good. Yoga is great for stretching. Yoga is also can work on your balance, but Tai Chi really works on your balance. Senior Tai Chi, they have senior Tai Chi, which would be great.
And what about your core muscles, Grace? How important is your core to overall leg strength and arm strength?
Very important. It's so important to have a strong core. Proximal stability allows distal mobility. That's what a common phrase in our PT school was. So proximal stability is
what does that mean for the lay person?
Yes. So proximal stability, that means that core has to be nice and strong. Distal mobility, so you can, use your arms and use your legs better. So it's just, it is very important. You see sometimes people that work out in gyms, they work out those arms, they work out those legs, but then they leave their core out. It's very important, core exercises.
And can you recommend some? And do you think it's safe to randomly go on YouTube or Google exercises for your core and other parts of your body? Again, you had mentioned contacting your physician in advance of starting a program. Do you recommend identifying some exercises and actually sharing those with your medical professional and say, here's what I'm thinking about doing. Are these safe for me?
You know what? Everyone has a different diagnosis. They might have back issues where a certain exercise program feels better than another. They could have, I could go, spinal stenosis. Spinal stenosis does well with a lot of flexion exercises. I know this is probably, maybe the people here don't understand what I am talking about, but some diagnoses require certain back exercises while others require other back exercises. So you would have to pay attention. If you went on a YouTube and said, oh, let me try this exercise, and you do it and you notice, wow, I'm getting some pain from that exercise, and guess what? That exercise is not good for you. So exercises, sometimes it's no pain, no gain, but other times the pain is telling you something. It's telling you this isn't right for me to do. So you really have to be aware when you go onto these, you go on YouTube and you're like, oh, let me look up these exercises. You have to watch how you feel when you do them, because you could hurt yourself. Just like with yoga or Tai Chi, if you're not careful, especially yoga, you can hurt yourself if you overdo it. So you have to listen to your body.
Is there an exercise, I guess you just mentioned how it's important that you should contact your physician before you start an exercise program. Someone is actually asking specifics around core work and wants to know, is there something else they can do instead of squat? It says swatting, but maybe she meant squatting.
Yeah, sit to stands is great. Pelvic tilt is a basic core exercise. It's like brings it down to level 1. If you know how to do that, bridges, that's another, working your abdominals and working your buttocks, hip muscles are good to work that core. Working, lying on your back, bending your knees, having a TheraBand and bringing your knees apart and together. There's so many different exercises, but that's why it's a great idea to go to your doctor, maybe get a prescription for physical therapy, maybe come in to learn some exercises that would be good for you. And the goal for therapy is basically to come in, learn a home exercise program, and go and do it on your own.
Grace, at the offsite physical therapy location that you work in East Chester, I recall seeing a device where you actually can do an analysis of a person's balance. Can you kind of
Yes.
explain what that device is? And do you need a prescription for that? How does it work exactly?
Well, it's called a Biodex balance machine, and it does test balance, dynamic balance, static balance, and it comes up with ranges for ages and where you fit in. But beyond that, I mean, we do a whole slew of balance activities called a Burg balance test, and we go through different balance activities and we rate you to see where you stand in terms of the high risk of falling, low risk, medium risk. Just like those 2 quick tests that I went through are a couple of tests that we would even do here. But when you come here, we do even a little bit more in-depth testing. That gives you a baseline of falls. You would, if your doctor, you would have to go see a doctor. You would need a prescription for physical therapy for gait and balance. And then you would come and you would, go through balance testing. And then the therapist would come up with an exercise program of stretches and strengthening exercises and balance, just a whole routine. I don't know if that answered your question or
Yeah,
not.
absolutely. And you mentioned the fact that you do need a prescription from your physician. That's what I was
Yes.
wondering, how could you access that service? Okay,
Right.
great. Do these exercises for your arms increase the risk for rotator cuff injuries for seniors if you're using weights?
Well, it can if you're using a weight that's too heavy. So you really have to be careful about this. That's why I say 1 pound, 2 pound, and definitely not overhead activities.
I mean,
That
bring your arms over your head. Okay.
Like that, or above, like working up to 90 degrees, like parallel to the floor, is safer than trying to work way overhead. That will cause shoulder problems, and also the amount of weight that you use. Just a can of vegetables, what is it? How many ounces, or a pound? I mean, it gives you some. So you should be careful about rotator cuff.
And one last question, and thank you, Bonnie, for your patience, but I just wanted to ask you, Grace, do people who have Medicare need a referral for PT? I'm guessing anybody needs a referral for PT. If you're on Medicare, do you still need a referral for PT?
Yes, you do.
Okay, and I just want to thank the folks who put links to articles about training and exercise and living well and balance. So thank you so much for sharing those in the chat. And I'm sure Bonnie and her team can make those available to others if they have questions later. But thank you so much, Bonnie, to you and to Gianna for the opportunity to talk about fall prevention in and outside the home and the importance of exercise. And thank you, Grace, for your time today. I know
Thank you very much.
So we really appreciate it.